and Life Science Community Connection call. Today we have a fantastic speaker. We have one of my peers, Andy Morris, who is a customer success manager here on the Health and Life Science vertical, and he's going to be going over Microsoft Teams for frontline workers. So with Andy, I'll kind of turn it over to you.
All right. Thank you, Sarah. You hearing me okay? Okay. Yes, welcome everybody. Just to reiterate, thank you for taking some time with us today. My name is Andy Morris. I've been at Microsoft now for about 5 years, and over that time, I have been in the our health and life sciences vertical the entire time. I've worked with different providers and payers and other companies throughout our EOU over that tenure, and currently I'm working with some of our bigger providers throughout the nation. So I'm really excited to share some things with you today. I plan to give you a whole lot of content today. So as Sarah said, just remember that this is recorded and you will have access to this deck later on. So definitely take a look at some of the things. If I'm going a little bit quickly, you can take a look at some of the things afterwards. So before I get too far into my presentation today, as I said, we're going to be talking about Microsoft Teams for the frontline worker and empowering frontline workers. So I want to take a moment here at the top to kind of define what we're going to mean by frontline worker today, because it can mean different things depending on the type of organization that you're a part of. So in my world, as I think about my customers, providers and large hospital systems, when I hear frontline worker, I'm thinking about, doctors and nurses and people who are kind of on the front line of the business, actually interacting with the patients. But the types of things I'm going to talk about today are going to be applicable to all of our different types of frontline workers across the industry. So whether you come from a payer account or you come from maybe a life sciences or a pharmaceutical organization, the things that I'm going to talk about today are going to be applicable to you. Some of my examples may kind of be provider focused, things like doctor and nurse use cases and things like that. But I think it all applies to everybody. And if you're having some trouble kind of envisioning that, like how this might work in your industry, I encourage you to use a few different resources. First of all, we've got this lovely Yammer community set up for us now where we can interact with each other. So I would encourage you to reach out in that Yammer community, not only to us Microsoft resources, but also to some of your peers throughout our other customers that might have some thoughts and insights and ideas. And then obviously reach out to your Microsoft CSMs and other parts of your account team as you need support with some of the things that I talk about today. So with that, what I'd like to do today is basically three different things. I want to start with a little bit of information about the industry and where we are today. I want to do a few demos for you to show you some real world examples of how customers I'm working with and customers that other parts of Microsoft are working with are solving some of the big problems in our industry. And then I want to leave you with about 2 or 3 go-dos that you can take out of this session and start working with within your organization today. So I'll go ahead and jump right in. This slide probably comes as no surprise to any of you on this call, but the pandemic has launched and accelerated several different industry trends. And even before the pandemic, healthcare systems were struggling not just to optimize their operations, but to adjust to new care delivery paradigms that meet changing patient expectations. So again, probably no surprise to anybody on this call, but the generations that exist here in our country today are experiencing their world in very different ways as it relates to technology, and healthcare is no different. We're seeing new delivery innovations happening in the Gen X and the Gen Z and the millennials that are very different from the way our older generations are experiencing healthcare. And so we're seeing that as a good thing. With virtual health being one of those major trends, the pandemic dramatically escalated the adoption of virtual health, which now we see stabilizing at about 38 times pre-pandemic levels, which is a good thing because we're seeing a lot of positive motion from virtual health. It's helping us bridge access gaps. So people in places where they were not able to access basic primary care are able to do that through virtual health now. However, as a result of these accelerating trends, we always have to keep in mind that first line or that frontline worker. And what we're seeing in the clinical space is a big escalation in clinical burnout. In fact, we've seen burnout swell to impact about 55% of frontline healthcare workers at any given point in time. And the number one and number three leading cause of burnout are the abundance of bureaucratic tasks and managing electronic health records and other computer-based work, respectively. Add to that, and this is again probably not news to a lot of your organizations, we're also seeing that many of your organizations are dealing with financial hardships right now. So at the same time, you're seeing a lot of frontline worker burnout. You don't really have the resources to be able to hire new workers very easily. And a lot of times in a lot of places, our industries are not finding as many frontline workers coming into the industry as we once did. So we're seeing that all of those trends are affecting the quintuple aim of our industry. So if we look at the quintuple aim across that spectrum, we see that clinical burnout is affecting each pillar. So providing better health, better care at lower cost, and an improved clinical experience, and even into health equity, we're seeing that this is becoming a major problem in our industry. And I've got one more slide that I'll use to just kind of bring that point home before we move into some more demos. And I found this quote in a presentation that Microsoft's Chief Nursing Information Officer gave at one of my customers a few weeks ago. And it really hit home with me, so I kind of wanted to share it with you. And that is that the moral distress of being unable to sufficiently care for their patients is among the worst hardships that healthcare workers have been forced to endure. So that's a pretty heavy statement right there. The idea that moral distress is influencing all of our healthcare professionals. And it can be one of those key issues that affect the workplace environment, causing a sense of isolation, feeling unheard and devalued. And it leads to a compassion fatigue, especially among our providers, that may result in actually losing a otherwise very talented healthcare provider to burnout, and maybe they even leave the industry. And we see that happening in a lot of our customers. So what this is leading to at the accounts that I work with and the customers that I work with, and I think this is true of a lot of CSMs like myself, is we're seeing our organizations trying to positively affect their workers' well-being with technology. So they're trying to do things that can improve that employee retention so that they don't end up in a place where they're having to replace those employees, which is a much more expensive proposition than trying to retain them. So employee retention. And then number two, what we're seeing is them trying to do more with less, or do more with what they already own. So I see a lot of my IT departments taking a very close look at their investments in companies like Microsoft and saying, what more could we be doing with what we already have here that can help improve the experience for my employees? So that's where I want to kind of start my demo portion. And I want to start with something, again, that you've probably heard of, and that's Microsoft Viva. And if you're not familiar, but I have a feeling you are, because if you've talked to your Microsoft team over the past couple of years, you've probably heard about this. Viva is our employee experience platform. And what I want to show you today over the next few minutes is how we're seeing this being used by healthcare organizations to improve the well-being of those frontline workers. So I'm going to go ahead and bring up my demo tenant now, and I'll show you a little bit of how this is working. So first of all, as you see on my tenant here, I've got my basic Microsoft Teams tenant running in a web browser. I've got the teams I'm a part of. And over here on my left-hand rail, I have a few different apps that I want to point out. And the first one is right here. Now, this is one of the first pillars of our Viva suite, and it's called Viva Connections. Now, what you're probably noticing here is that nowhere on here does it actually say Viva Connections, because we've configured this in this demo tenant to be customized to my company. So my fictional company in this example is called Smarter Health. We have 2 T's in smarter, just to indicate how smart we are. We get an extra T. And what we see as we start to look over smarter health is that Viva Connections is bringing in information from across this organization into a place that's easy for me to digest. So if you remember, one of the things that is leading to clinical burnout, we're seeing that people and frontline workers are spending too much time in front of their computers. So the idea with Viva Connections is that we're going to bring information from across our organization that already exists, bring it into a place where people are already working to make that experience much better. Also, Viva Connections, specifically for frontline workers, you're able to curate an experience that is meaningful for that worker. So if I look at my demo persona right now, I am a doctor. I'm Dr. Sally. So this Viva Connections experience has been curated for me to bring up information that is meaningful for me. So as I look across my tiles here, one of the first things that pops out is you've got a tile that's going to give me access into some of the resources that are available to me as a doctor if I am feeling burned out, if I'm feeling stressed, if maybe I've had something terrible happen on a shift, which happens in our providers sometimes. I have access to resources where I can go and deal with those feelings, helping me deal with that burnout. And as you look down here, you'll see a little bit more of our Viva Connections experience, which is bringing different information from my organization into Teams. You also have this dashboard feature on the right here, which is, again, curatable and customizable for different roles in your organization. So a first-line worker or frontline worker can have a different experience here than maybe your knowledge workers have. So a few of the things we have configured in this tenant are your payslip. For example, it reaches into my payment system and shows me what I have on my last information about my last pay period. I can see what holidays are coming up for my company right here. And if I have time off to report, I can go right here and I can start reporting my time off. And it's all done right here within Teams where I'm already working. So again, the idea of spending less time in front of a computer to find the information I need by using Viva Connections to curate that experience right here within Teams. Secondly, as far as Viva is concerned, one of the pain points we're hearing about from some of our provider customers and other customers across the industry is that there's a lot of learning that needs to happen in our industry. And some of our customers struggle with the best way to curate that experience for their frontline workers. I was just at a customer about 3 or 4 weeks ago now. We were talking about the way their nurses access learning. And one of the pain points they have is that they have a lot of internal training that they've developed and that lives out on a SharePoint site, but nobody ever goes there. And add to that, they have a very young nursing population. They estimated about 70% of the nurses were between 0 and 3 years in career. And so those people needed an easier way to access the information that they have, because what was happening at their organization, they found, was when these nurses had questions about how to do things about their job, whether it's operate a machine at the bedside or something like that, they were turning to Google to find those answers. And that would take them to places like YouTube or TikTok. So now they had their nurses going out on the public internet, finding TikTok videos about how to do their job, which really terrified their leadership. So what we talked about was a better way that we might surface up the content they already have into a place that's easier for their nurses to consume. And that's where Viva Learning came in. So Viva Learning is another pillar of our Viva suite, where we're able to surface up learning from various content providers into a unified experience within Teams. So once again, you'll notice this is a curated experience for each of my job types. So again, I'm Dr. Sally, and I've got some things that are trending in my organization over here. I'm able to pick some interests and curate some content for myself around what I'm interested in, but also I'm able to bring up some of that training from my organization, the things that I need to know as a doctor from my organization on how to do my job. So again, instead of going out to the public internet to find things that might not be quite reliable, I can do this all right within Viva Learning and surface it all up that way. So before I move on much further, I wanted to show you one other thing. So what I hear about from a lot of my customers that I work with is that, Teams is great for my knowledge workers, those people who are in front of computers all the time. But my frontline workers, my doctors and my nurses, and those people that are not always in front of a computer have a really hard time getting into Teams. So what I wanted to show you was a way that I'm seeing some of my more successful customers in Teams get Teams out to those frontline workers and get them to use it. And that is through the Teams mobile app. So up on the screen right now, I've brought my bottom. I've got that Viva Connections app. And if I click on that, I go right into my mobile experience of Viva Connections. So you should see that this looks very similar to the same dashboard that I saw curated for me on my web browser view. It's also available on my mobile device. Same thing with the learning experience. So I click into Viva Learning. You'll see that I have those same types of experiences, that are the same type access to that same content right here on my mobile device. So if I'm that nurse that's struggling with something at the bedside that I need to find some information about, I can pull out my mobile device, open up Teams, access that information, whether it's information about my learning about what I'm doing at the bedside, or whether it's information about my HR system or whatever I need to do in Viva Connections. It's all accessible, secure, and compliant right here in Teams, right here on my mobile device. So these experiences translate over to the mobile experience as well. All right, one last thing I wanted to show you in terms of our Viva Suite before I move on to some other things is one other aspect of Viva that I'm seeing my accounts really take advantage of right now, and that is our Viva Engage platform. So again, the concept comes up of bringing things from various parts of your organization right into Teams where work is being done. So Viva Engage, if you've been around for a while, may look very familiar to you because it is really our Yammer experience of enterprise social media being brought into Teams to once again unify the experience for our users. So with Viva Engage, what I'm seeing in my customers is my organizations are trying to build more of a community among their people using enterprise social. So what you'll see at my most successful customers that use Viva Engage and Yammer is that they use it for various things, whether it's connections with their leadership or connections around special interests. So for example, I've got a community here in my demo tenant around neurological special interest groups. So if you're thinking about, if you're a large organization that's dispersed over many different locations, but you have similar job functions in those locations, this is a place to connect your people together, allow them to connect with people with similar maybe job functions or interests, and then get them talking about their jobs and what works for them and what doesn't work for them. There's also the side of this that is very social media centered. So I have a customer a few weeks ago that I was talking to about Viva Engage, and they got very excited about just the thought of being able to connect with others in their organization around non-work related information. And this one was kind of funny because this person got really excited about the idea of having a group about dogs at their organization. So they wanted to have a community about dogs, that's Smarter Health or whatever your organization is, where people could come in and actually just have a relaxing conversation or an uplifting experience where they talk about their pets in this Yammer group. And that was something that they thought would be very meaningful for their organization. So once again, before I leave Viva behind, a couple things to remember. Making our organization smaller by bringing in the information, whether it be organizational information from HR, corporate comms, and the like through Viva Connections, or learning through Viva Learning, or enterprise social, bringing that all into one easy to find and easy to search and easy to interact with place is going to increase the well-being and the positivity in your organization and ideally will start to combat some of these signs of burnout that we're seeing across the industry. One other thing I don't think I mentioned about the three things in Viva that I just showed you, these are all included in most of your enterprise Microsoft licensing. So when we're talking about the idea of doing more with less, what I just showed you could be done with very little cost and just some configuration to get the right experiences configured for your users. So again, the idea that you can do more with less using Teams for your first line workers. Okay, I'm going to jump back to my deck for a couple of minutes here. And as I wrap the session up here, I wanted to call out a few other things that are outside of Viva and maybe outside of that employee experience that you could be doing within Microsoft Teams, again, without really any further investment than what you've already made, but just the basic Teams functions that I see my successful frontline customers using. So first of all, I see a lot of my frontline worker customers using Teams for secure messaging. So using the basic chat features to be able to rapidly find near or real-time data and relay that to the right care team members at the right time. Lots of times people don't realize that Teams is HIPAA compliant, high trust certified. And so being able to use that for that secure clinical messaging is very useful for a lot of my customers. I see them using things like shown on the slide here, the smart camera to capture, annotate images and share those out with people who need to see them. Also, another interesting feature that a lot of our frontline workers are taking advantage of these days is our walkie-talkie push-to-talk feature. This is a feature that comes with Teams. It's an app that you can use on a mobile device, on iOS devices, and some Android devices that give you that real-time walkie-talkie push-to-talk experience. I've even had some customers start to work with some of our device partners where they can interact with the walkie-talkie feature in Teams just by clicking a button on a headset, and without even having to have their phone or the mobile device open, they're able to use the walkie-talkie click-to-talk feature, which is becoming more and more popular among our customers. Our Shifts app is something, again, that we see a lot of frontline worker organizations taking advantage of. Shifts is an app within Teams that gives managers the ease and convenience in deploying schedules and gives employees greater control in viewing and managing their schedules. So Shifts can be used out of the box and by itself. We also have integrations with timekeeping solutions like UKG Dimensions that can be integrated within Shifts so that workers can manage their schedule themselves, submit time off, and even click in and out just using Microsoft Shifts. And finally, as we get kind of to the end here, no discussion about frontline workers and healthcare would be complete without at least a mention of Microsoft Teams as a virtual health platform. So the ability to deliver that virtual health experience through Microsoft Teams. And we have various solutions that can solve for that use case. So it can range from a very simple and cost-efficient solution, like our Microsoft Booking solution, where your customers can come in and book time with your frontline workers to be able to meet with them, whether we're talking in a clinical setting or not. And then it can range from there up to much more complicated experiences, like fully functional experiences from partners like Teladoc, or custom experiences through our Azure communication services plus Microsoft Teams. So lots of things to give thought to there on the virtual health platform. But to wrap us up today, I see we're down to a couple minutes. I wanted to give you a few action items to take from this session today. First one, get Teams into the hands of all of your workforce. Whether we're talking frontline workers or knowledge workers or whomever they are, everybody can be using Teams. And think of Teams as that portal into all of the great stuff that I showed you today. All of the ability to leverage those Viva components all lies within Teams. And through the mobile experience and the desktop experience, we can enable all of our workforce to use this great tool and really get the value out of it. Second, put some time into configuring those experiences in Teams that will improve frontline worker or knowledge worker or all of your workers' well-being. There's ways to curate left rail experiences to give access and highlight certain apps over others. And if you give some intentional thought to that, you can really configure a meaningful experience for your people. And lastly, reach out to Microsoft. Your CSMs like Sarah and I and Jonathan, we're here to help you with these things. Also, other members of your account team can help. And then lastly, and I didn't put it on the slide, but I'll just say it again, reach out to each other. We've got this great Yammer community. We can leverage it. We can talk about our challenges and our successes there, and you can reach out to help from a large group of Microsoft CSMs in that community as well. So once again, I appreciate the time. Thank you for listening today. And Sarah, I'll pass it back to you.
No, thanks, Andy. What a great session. And if you could just forward on, just to make a quick announcement to the group, we will not be having a session next month because we are actually we're bringing this back, the Microsoft Teams Productivity Summit. So we have a list of great sessions the week of December the 5th through the 9th. And so it will be listed in this presentation. So feel free to register. It's open to all. And as Andy mentioned, if you do have a question or if there's a way that we can help assist you, please feel free to post it out on the Yammer community. We're more than happy to reach out to you directly, or feel free to contact your CSM within your account. And here is just a quick list of all the sessions. We have sessions focused on Teams and ServiceNow to what's new in Teams. That's usually a great session for a lot of your champions groups to attend, to reporting, to Teams apps. So we look forward to seeing you in those upcoming sessions. And also, just moving to the last slide, Andy, if you don't mind, if you are new and are not aware of this Yammer community that we've been talking about, feel free to go ahead and fill out this quick information form about yourself, or feel free to take out your camera and use the code that's listed on the screen, and we'll get you added. So with that, we are at time. Thank you again for everyone for joining this session. We look forward to seeing you in just a couple more weeks on the Teams Summit. Thanks everyone.
Everybody.
Thanks, Andy.
Thanks, Andy. Have a great day.
Thank you.